Tymlos Injection is a prescription medication containing the active substance abaloparatide, which is a synthetic analog of human parathyroid hormone-related protein. It is used for the treatment of osteoporosis in postmenopausal women at high risk of fracture. Tymlos is administered as a subcutaneous injection. Indications. Tymlos injection is indicated for the treatment of osteoporosis in postmenopausal women at high risk of fracture, including those with a history of osteoporotic fracture or multiple risk factors for fracture. How to use. Tymlos injection is administered subcutaneously using the pre-filled pen provided. Before administration, patients should be instructed on proper injection technique and site rotation. The injection site should be cleansed with an alcohol swab, and the needle should be inserted at a 45 to 90 degree angle. The recommended dosage of Tymlos is 80 micrograms administered subcutaneously once daily. Tymlos should be injected into the thigh or abdominal wall. The injection site should be rotated daily to minimize the risk of injection site reactions. Contraindications. Tymlos injection is contraindicated in individuals with hypersensitivity or allergy to abaloparatide or any components of the formulation, Paddy's disease of bone metastasis, hypercalcemia, or other metabolic bone diseases. Special instructions. Patients should ensure adequate intake of calcium and vitamin D while receiving Tymlos treatment, as these nutrients are essential for bone health. Patients should undergo periodic monitoring of serum calcium levels during Tymlos therapy. Bone mineral density measurements may also be performed to assess treatment response. Side effects. Common side effects of Tymlos injection may include hypercalcemia, elevated blood calcium levels, dizziness, headache, nausea, fatigue, injection site reactions, pain, erythema, bruising. Serious side effects such as orthostatic hypotension, palpitations, and hypersensitivity reactions are rare but can occur. Patients should seek medical attention if they experience any unexpected or severe side effects.